Thanks be to God, and thanks to the AMPO clinic, we managed to keep our children alive.
The AMPO clinic is a humanitarian organization, and the patients who come here are people who are more or less destitute.
We could not cope with life without AMPO. We come here and we are treated. Inshallah, we are given medicine and the staff always treat us with love and respect.
We work on the principle of providing humanitarian aid, and those who come to us for help are never turned away because they have no money. I can only say that if AMPO didn't exist, it would have to be invented.
Many people in Europe think that Africa is a lost cause. I wanted to prove to everyone that Africans are capable of creating something positive and seeing it through on their own initiative. AMPO Association Manarinoma pour la protection des orphelins is the umbrella association for all of our projects. Manarinoma translates as "the good is never lost", and the association was originally set up for the protection of orphans. When I first went to Burkina Faso 33 years ago, I saw poverty I had never seen before. I couldn't understand why 7-year-old children were living alone on the streets. When I asked who looked after them, the answer was no one. Something had to be done, and it was up to me. The AMPO project that is best known throughout the country is our clinic. We treat about 60,000 patients a year, of whom 60% are babies and the rest are mostly women, living in abject poverty. The clinic is unique in Burkina Faso because the patients only pay 30 cents for treatment and medicine is free. Patients often cover long distances, 10 to 12 kilometers at night and on foot to reach the clinic. At 5 o'clock in the morning, there are already 150 people queuing outside. They are in dire need, unable to afford 10 cents for a paracetamol tablet, facing the many tropical diseases we have here.
The AMPO clinic was set up in 1998. It started on the initiative of our founder, who wanted to provide first aid for the deprived children in her care.
When I first started working with street kids, I asked a carpenter to make me a small wooden box. It was like this, and I painted a red cross on front of it. Here in Burkina Faso, you can get practically any medicine without a prescription, unlike in Europe. This is how I started with first aid. At that time, there was a fantastic elderly doctor, Dr. Balla, God rest his soul. He was a wonderful doctor who treated all my street kids for free, everything from malaria to stab wounds. But there were more and more sick people waiting outside our gate, and so I set up 2 rooms, and together with one doctor we began to provide treatment for 2 hours every morning. The need was enormous, and eventually I got together the money to build the clinic. Most people here, especially the poor, don't die of their illness, but a lack of money. I couldn't stand by and watch women covering the face of their baby with a scarf when it just died in their arms, all because they didn't have 10 cents.
The clinic treats around 60,000 patients a year, 60% of whom are children. Patients come from a catchment area of about 40 kilometers around the capital, Ouagadougou, and from the poorer districts of the city. It is a unique humanitarian institution in Ouagadougou and indeed in the whole country. Irrespective of age or religious background, anyone seeking help receives it.
At times when malaria is prevalent, we can have more than 100 patients a day. We have several consulting rooms with at least 2 medical officers in each, and we try to divide up the patients according to the treatment room. We start at 7 o'clock in the morning and work until the last person goes home. There are no inpatients, so we cannot provide medical care around the clock.
We get people not only from Ouagadougou but also from the surrounding areas. Sometimes we have difficult cases to deal with and we try to cope with the means at our disposal. This is the rehab center, founded and supported by the Lutz family in Germany. Many of the children coming to the rehab center can scarcely use their limbs, but after treatment they are well enough to go back to school again, just like all the other kids. They are delighted. We also have a number of adults who come for treatment for conditions resulting from trauma, neurological diseases, partial paralysis, and a whole range of other ailments, including meningitis. In most cases, they can be treated successfully and can leave again with a smile on their face. It costs 50 cents per treatment for children and €1 for adults. Other rehab centers in Ouagadougou are very expensive, but my view is that we are here to provide a health service. And if a parent turns up with a child needing treatment and they don't have 50 cents, we treat them anyway. I think we have to pay tribute to the wonderful work of our founder. The medical care we provide here is free of charge, including medication from our stocks. If we have to write prescriptions for patients to take elsewhere, we pay for these too, if the patient cannot afford it.
Since AMPO started, we have never actually sold or charged anyone for medication, no matter what it costs. It's a gift. It is handed out free. When patients are referred to us and don't have the money to pay for medicines and the prescriptions they bring, we pay for those as well, if we don't have them in stock.
AMPO is famous throughout the country for its wheelchair project. We build our custom-made tricycles in our own workshop and distribute up to 150 per year to people with disabilities. That is why we are so well known, and we receive medals, certificates of honor and thank you letters from grateful people from far and wide. When we began 24 years ago, Edouard and I only had a hammer and a screwdriver to work with. Today, we have our own small factory, and the people working there have disabilities themselves.
This is where we repair wheelchairs. We also sell spare parts at a maximum cost of €1.50, but repairs are free of charge. We also manufacture our own tricycles. The name of the workshop is Tondno, and we make custom-built wheelchairs for adults and children, providing them with a means of mobility, like giving them feet to walk and overcome their disability. 120 people were given wheelchairs from my workshop last year. So we manufacture somewhere in the region of 10 wheelchairs per month. We also have another project, the Mobile Wheelchair Project, where we travel around the country throughout Burkina Faso to towns and villages and provide wheelchairs to those in need, sell spare parts and carry out any necessary repairs.
We also make special models for school children. By turning a screw, they can remove the front wheel and can sit at a desk with all the other children in class. I'm like all the others, I'm just like you, is the feeling we try to achieve. Every child with disability is given a wheelchair and we pay their school fees on top. What is exceptional at AMPO is that all our projects work hand in hand. If we come across a child who is too thin, it is referred immediately to our project for undernourished infants. A woman obviously underfed with 3 children, is included straight away in a microcredit project where we show her how to earn her own living. Battered women? For them we have our wonderful Mia Alma project. This project houses 50 abandoned girls and their children. They are all younger than 21. They have survived incredibly traumatic experiences, and now they can live in safety for the first time in their lives, go to school or learn a trade. What a happy place is this.
Often the mothers don't know how to feed their children properly. We teach them how to feed their children, and if necessary, we keep the children here to recuperate, or they come back twice a week so that we can monitor them. This month, we have 33 severely malnourished infants and 70 moderately undernourished children in the center. Our capacity is limited, and we can't treat everyone, so unfortunately, sometimes we have to refer people to other centers. But the care is not the same. The particular thing about us is that everything is free. The care, the milk, the porridge made from maize and local ingredients to feed the children. Another feature of the center is that if the women are desperately poor, we give them monthly rations to provide food for their children. We teach them how to make it and pass the knowledge on to their neighbors. She's saying that she benefited a lot from AMPO, receives care and advice, food and medicine, and she would like to thank us. She says she is ill, but she feels that she is being well looked after. This is the referral center of AMPO. The clinic looks after medical needs, and if they can't feed their families, the women are given food. But if there are any additional social issues, they are referred to us, because we provide the social services at AMPO. We also work with the Linda Wiemde project. Women come here and we organize microcredits for them so that they can look after themselves and their families.
We also have a training farm at AMPO to teach 50 young farmers organic farming methods. They too can come to our clinic for treatment or vaccinations. They stay with us for 2 years before they return to their villages. We, AMPO, dig wells for them, and they are then ready to set up a farm of their own. They work together as a cooperative, sharing their newly acquired knowledge with the neighbors. They don't spread chemical fertilizers on those fields. All this is done by God's guiding hand. He brings me together with those who are willing to help. We have our charities in Germany, Denmark, Switzerland and England, and even a foundation in New York, so we have many people offering their active support.
We are a team of young people from Germany. Some of us are students and some have regular jobs. We all live in Germany, in Hamburg, Stuttgart, Berlin, Mainz, and we communicate on the internet, by Skype, email or WhatsApp, but we also try to meet up once a year. Our aim is to collect money from family, friends, colleagues and anyone we know. And we enjoy coming to Burkina Faso regularly to meet our friends and partners at AMPO. In Ouagadougou, we finance medical care for children whose parents cannot afford to pay, and we are very happy with our partners here, especially Felix, who goes around the local hospitals every day looking for patients whom we can offer financial support. We are also very happy with our cooperation with AMPO, because without them, our aid would never reach the children. So we can assure our donors in Germany that 100% of their donations reach the children directly and are used for the benefit of the children.
We are particularly pleased to enjoy the trust of a prominent surgeon who performed the first operation in Burkina Faso to separate Siamese twins. Soon after the operation, he brought them to our AMPO rehab center because he had more confidence in our standards of cleanliness and hygiene than those in the state hospital. He came by every day to check over several weeks, and meanwhile the twins are leading a healthy life in a small village far from the capital.
Today, after more than 20 years, the clinic is struggling more and more to cope with the demand from the growing number of patients, lack of equipment and material, lack of specialist staff, and so on. The change in status of the clinic to become a recognized medical center is necessary to meet the requirements of the Ministry of Health and to meet the standards of WHO, the World Health Organization.
I'd like to say thank you to all our donors. May God protect them and grant them long life, so that they can continue to support us. We need your help to expand our clinic and our service for people in need.
Here in the ophthalmology department, we need funds for equipment to prescribe and manufacture glasses for those who need them. In the long term, we would like perhaps to have the premises and the equipment necessary to perform cataract operations, an operating microscope, for example, in cooperation with others. Today it can be said that we have a huge demand for dental care at AMPO. We cannot meet this demand because we don't have the hardware and material. You see, we have 2 dentist chairs installed in rather primitive consulting rooms. But there isn't even a ceiling and there's no air conditioning. But we still do our best to meet the needs of our patients. This chair has been in use for more than 10 years now, and lots of things are going wrong with it. But we do what we can. My wish would be to extend our service to treat people in the morning as well as in the evening, but for that we would need the equipment and a permanent dental surgeon. We would like to expand. On a technical level, we need the resources to develop so that we can meet the requirements of a recognized medical center. We also need to generate resources ourselves because we are mostly dependent on financing from abroad. And let me pay special thanks to AHK Berlin for their generous support. We need the means to expand our programs and make our own contribution in the interest of caring for vulnerable people.
Today I'm proud of our 8 African directors, each one in charge of a different project. Major issues, problems and concerns are tackled within the group. There is no European working here. I am still the founder, but I no longer have a say in the running of things. I can only offer advice, that's all, and I'm happy and proud to see what a professional job the directors are doing. Best of all, however, is the success of our former orphans. Today, 25 years on, the tide has turned and we now have IT specialists, engineers, 50 midwives, 150 nurses, laboratory assistants, many teachers and bookkeepers, all of them previously children without a future. Many are now married and have children themselves, and they often come back to visit AMPO, the place of their own childhood. There they help their little brothers and sisters at AMPO today with their homework. AMPO children are truly wonderful.